In 2019, nearly 14 of every 100 U.S. adults aged 18 years or older currently smoke cigarettes. This means an estimated 34.1 million adults in the United States currently smoke cigarettes. More than 16 million Americans live with a smoking-related disease, according to CDC.gov. I started smoking cigarettes out of curiosity when I was 14 years old. The first puff I had taken was extremely harsh and on my throat, and I did not like it at all. Even though I did not like it, I would still have one with acquaintances every once in a while, and this led to having an addiction. I smoked until I was 26 and smoked at least 2 cigarettes a day before I knew it was time to quit. I had started feeling the negative effects of cigarettes and looked to alternatives to help me wean off of smoking. In order to make the decision of not to smoke, we must first be knowledgeable about it. So first we'll be discussing what are the harmful effects of smoking, what happens when you quit smoking, and what are some alternatives to smoking. First are the harmful effects of smoking. Cigarettes contain about 600 chemicals, which, when these ingredients are burned, they generate about 7,000 chemicals. Many of these chemicals are poisonous, and at least 69 of them are linked to cancer, according to the American Lung Association. Smoking can cause a number of harmful health effects, including cancer, blood clotting, diabetes, problems with pregnancy and newborns, erectile dysfunction, wrinkly skin, cervical cancer, lowered immune system, high cholesterol, loss of appetite, COPD, heart disease, constricted blood vessels, persistent coughing, bronchitis, unhealthy teeth, dull sense of smell and taste, smelly hair, poor vision, anxiety and irritability, and early menopause. Evidence also shows that cigarette smoking has caused more than 480,000 deaths each year in the United States. This is nearly 1 in 5 deaths. Now that we've seen the extent of the problem, we can explore what happens when a person quits smoking. Luckily, most of the damage done from smoking cigarettes is reversible when a person quits. 20 minutes after your last cigarette, your blood pressure and pulse will return to normal. 8 hours after your last cigarette, your carbon monoxide levels will return to normal. By the 1-day mark, you've already decreased your risk of heart attack. At 48 hours, previously damaged nerve endings start to regrow. Within 3 days after quitting smoking, you'll often find yourself breathing more easily. Smokers who successfully make it past the 1 week mark are 9 times as likely to successfully quit. Within 2 weeks of quitting smoking, you may start to notice you're not only breathing easier, you're also walking easier. This is thanks to improved circulation and oxygenation. In just 1 short month, you can experience many health changes related to stopping smoking. One is feeling a sense of heightened overall energy. You may also notice that many smoking-related symptoms have decreased, such as sinus congestion and shortness of breath while exercising. In addition to these benefits, fibers in the lungs that help keep the lungs healthy are growing back. These fibers can help reduce excess mucus buildup and protects against bacterial infections. After 6 months of quitting, many people notice they're often better able to handle stressful events that come their way without feeling like they need to smoke. They may also notice that they're coughing up much less mucus and phlegm. After 1 year of quitting smoking, your lungs will have experienced dramatic health improvements in terms of capacity and functioning. You'll notice how much easier you can breathe when you're exerting yourself and how much less coughing you have compared to when you smoked. In 3 years after quitting smoking, your risk of heart attack has decreased to that of a non-smoker. 5 years after you stop smoking, your risk of death from lung cancer has dropped by half compared to when you smoked. After 10 years, your risk of dying due to lung cancer has decreased to that of a non-smoker. The cells that were previously precancerous are now replaced with healthy cells. The extent of the problem is clear, so too are its benefits when you quit smoking. What steps can we take to help bring about a solution? Next, we will talk about alternatives to smoking and try and help a person quit. There are many alternatives to help smokers quit smoking, including nicotine replacements like nicotine patches, nicotine gum, and vaping. Studies also suggest when the urge to smoke a cigarette comes on, that going for a walk around the block will help get the smoker's mind off of smoking. I personally have tried all these methods and have found success with vaping. Vaping involves heating up a mix of vegetable oil and propylene glycerin with added nicotine to create a vapor. You can choose the level of nicotine in your vaping liquid to help wean off of cigarettes. After a while, you can bring the nicotine level down to 0 and quit vaping altogether. Breathing in anything except oxygen is harmful, but vaping is significantly less harmful than cigarettes. Choose a method that is best suited for you to help stop your smoking habits. We can all afford to live a healthier life, and quitting smoking is the first step in achieving this goal. Thank you.